you, Chris. Well, many public health campaigns today have alerted people to the dangers of sitting for too long. And given that you've been sitting for well over an hour now, can I encourage you to stand up and move around for 10 seconds whilst I continue with this talk? So the major difference has been that campaigns in the past have encouraged us to do the second part of this statement, to move more. Whereas Raw recently, it's become clear that in addition to moving more, we also need to sit less. In other words, there seems to be independent health effects from spending a lot of time sitting. Now, if our friend Homer Simpson, 10 years ago, was hearing a public health message, it would certainly be to move more. So in his typical day, he would spend 30 minutes driving to work. He reclines quite considerably for a number of hours whilst he is working. He then hops back in the car and drives home, and then spends a considerable amount of time sitting down watching television with his family. Now, he was hearing the message, circa 2005, that he needed to accumulate 30 minutes of moderate to vigorous physical activity, equivalent to a brisk walk, in order to meet the physical activity recommendations, which are the current recommendations in Australia. So, if he was asked the question, "Are you active?" he would say yes, and he would think that he is doing what he needs to for his health. But it has become clear that in addition to him doing something good for his health, the fact that he is sitting for a long period of time is detrimental to his health. How many people here would spend on an average day more than 6.5 hours sitting down? Okay, now, whilst it has been shown that those who have jobs that predominantly involve a lot of sitting earn more money than those whose jobs involve more standing, it does come at a cost to your health. And it does seem that this figure of 6.5 hours is the threshold where health concerns or consequences tend to kick in, independent of how much physical activity you do. So you can be doing a lot of physical activity, but if you're spending a large amount of time sitting, and if you're not breaking up your sitting, so every 30 minutes, if you're not getting up to go to the toilet or to stretch your legs, then that also can be detrimental to your health. This evidence is well established for adults, and there have been promotional campaigns to try and get adults to get up and move around more. However, there is an absence of evidence in our youngest children, those under the age of 5. Why is that? Is that because they are less important? No. Particularly when you think that many of these adverse health consequences, cardiometabolic health, overweight and obesity, have their genesis in early childhood. It does make sense to commence preventative efforts to try to reduce the amount of sitting in our youngest people. But that would only be the case if our young children did spend a lot of time sitting. And up till recently, we didn't know if that was the case. Some evidence that we had collected from over 1,000 children in areas around Melbourne suggested that even our youngest children were spending nearly half of their waking hours being sedentary. And this alarmed us because it was the only age group where we didn't have data, but it was showing that our youngest children were more sedentary or spending at least large proportions of their time sitting that were above what we were seeing for primary school age children. And this led us to start an area of research to try to investigate not only how much time were kids this age spending sitting, but in what context were they sitting? Was it occurring in the home, in the preschool? And was it linked with any adverse health consequences? Or if they sat less, was it going to be good for their health? And in two areas where it has been shown that sitting can be detrimental to their health, one is overweight and obesity. And in children in Australia at age 4, around 20% or 1 in 5 of our children are either overweight or obese. And it is independently related to the amount of time they spend sitting. The other area that's become very important is cognitive development. And in particular, areas of cognitive development associated with executive function, such as working memory and self-regulation. These skills are very important at an early age when neural networks or connections are being laid down in the developing brain. And working memory and self-regulation have been shown to be better predictors of school readiness than a child's IQ. So they will do better at school and enter school more ready to learn with higher levels of these skills. And whilst it hasn't been shown causally that sitting and executive function are related, it has been hypothesised based on observational studies where they have looked at children in these settings and found that those that move around more tend to have higher scores on executive function. And this is an area of research that we are currently investigating in around 500 children across the Illawarra, looking at their time spent sitting in preschool and also looking at their executive function. And when it comes to preschools, we're actually also interested in the amount of time that kids are spending sitting in preschools, because around 80% of 4-year-olds are attending preschool on average 2 days a week. Now, we might think that these are active environments, but again, our preliminary data is showing that around 46% of a child's day at preschool is spent sitting. So quite large amounts of time during the day is spent in this posture, which we know is potentially not good for their health. So we're currently conducting research trying to map some of the patterns, how long they're sitting for, what's the context for it, and then looking at how it's related to executive function, and then from that, working with childcare staff to try to investigate ways that we can reduce this. So one of the first things we'd like to do is, if that 46% is true, can we modify a preschool environment so that kids are only sitting for, say, half of that time, and see if that has an effect on certain outcomes? So how might we do that? Well, we need to think creatively, because as you can see here, this room is full of chairs. It's become the norm when we go into any learning environment that we sit down to learn, when actually it's been shown that you learn more effectively by not sitting down. So are there ways, like this child here on the left, if you're sitting down at a table and you're going through a series of steps to make an object like you would in craft, is there a way that you can learn a series of steps like you would in martial arts, where you might have to learn a routine, but you can do it being physically active? The same with this girl on the right. She is actually learning about shapes and learning about measurement, not by sitting down and learning it but by actually walking along a line that is in a certain shape, and by counting out how long it is in terms of measurement. So trying to work with educators to come up with active learning strategies that actually move from a sitting posture into a standing posture is something we're looking at. Are there ways that we can replace sitting desks with standing desks? Sitting tables where you sit down for lunch with standing tables. Some simple environmental modifications there that might also increase the amount of time spent sitting. And can we break up sitting? So this is an activity we've been doing with local preschools, where a buzzer goes off like an egg timer after 20 minutes if the kids have been sitting down. The kids get up, they move to a certain area, and just for 3 minutes, they undertake a vigorous type of activity that is not only fun and enjoyable, but it's also developmentally appropriate for the kids. They enjoy it, then they go back to what they're doing. And we've found that if we can do this 3 or 4 times a day, then it increases considerably the amount of moderate to vigorous activity these kids participate in, which has been shown to be related to their weight status and their bone health at ages 8 and 11. So if we can put all these together, we'd like to first of all quantify what the effect might be on energy expenditure, because even a small amount, and we've calculated it to be somewhere in the vicinity of 30 kilocalories over a day, may translate into larger benefits over a week, over a year, that may just be enough to tip the energy balance from being positive to negative and potentially prevent or reduce the prevalence of overweight and obesity in this age group. So that's some of the work we've been doing. If you like that, then can I suggest a good way for you to support it, and a good thing for you to do to your health, is to finish with a standing ovation. Thank you.